We have a new name for the coronavirus. The World Health Organization has officially called it COVID-19. Co for corona, Vi for virus, D for disease, and 19 because it started last year.
For Americans who are watching this, how serious is this? What's keeping you up at night?
The problem is that this is an evolving situation. Literally every day we learn a little bit more about it. I mean, we have the 5 individuals in the United States who are travel related. Now we see something which was clearly hinted at in what's going on in China, that you can actually have transmission from one to another.
The staff are working flat out trying to keep these people from deteriorating further. They're trying to stop them from dying. This isn't an intensive care unit, it's an emergency ward. The ICU is full.
This morning, major grocery stores working overtime, ramping up staffing to get food and supplies from the warehouse to supermarket shelves.
We're still going to be able to feed people because we have these 1,300 trucks a day, plus more coming.
I would just ask that we err on the side of preparedness versus panic.
A shortage of toilet paper, hand sanitizers, and soap expanding. In some stores, now freezer sections and fresh meats also cleaned out.
According to a governor's office spokesperson, cities can now require businesses to make their employees and patrons wear face masks.
Putting at least a meter between yourself and someone who might be sick isn't always easy.
This is roughly the distance that's being recommended. So if you're near someone, is this comfortable?
Considering the situation, yes.
Scientists say social distancing can make a difference if done early enough.
And so we believe right now that the higher rates being experienced around some parts of our state are mostly related to behavior.
Stunning news. The President of the United States now confirming to the world that he and the First Lady of the United States have both tested positive for the coronavirus and they will quarantine.
Pfizer and BioNTech reporting the first results from their phase 3 vaccine trial, saying that in this interim look, the vaccine showed to be more than 90% effective.
Tonight, news on a second vaccine. Moderna announcing its vaccine is nearly 95% effective.
We're in a crisis situation right now in Austin, and we're among the cities that we're able to keep the numbers down low. We have one of the lowest mortality rates in the country, but I am real concerned with the spike that we're seeing now.
I think it's hard not to acknowledge the fact that we're hearing a lot about this Delta variant. You know, what a variant is just like with any type of organism, organisms get smarter and they kind of change their shape and their structure. And this organism now has a new strain, and we call it the Delta variant, and it's just a lot more contagious.
County leaders are now asking people to wear masks regardless of vaccination status, stay 6 feet away from others, and avoid crowds.
The best way to protect yourself against the virus and its variants is to be fully vaccinated. It works. It's free, it's safe, it's easy, it's convenient.
Welcome to the Herbert Family University Lecture Series. I would like to personally thank Helen and Jeff Herbert and their family for making these lectures possible. My name is Brent IVerson. I'm a chemistry professor and dean of the School of Undergraduate Studies. Last night, we heard about the February snowstorm and what the freeze went wrong. Tonight, we turn our attention to COVID. Well, it was a chilly late winter morning, Thursday, March 12th, 2020. At the time, there were only 2 confirmed cases of COVID-19 in all of Austin and no confirmed examples of community spread within the city limits. At 6:15 a.m., my wife and I start our local gym class, a 60-minute workout. After feeling absolutely fine all weekend on Monday morning, my wife and I awoke feeling surprisingly ill, and the next day we found out we had tested positive for COVID-19. A couple months later, when the gym reopened, we discovered that all 16 of us present that morning had become sick with COVID. It turned out that a guest coach who flew in from Seattle to lead the class had been sick with COVID-19. 3 of us at the gym, not including my wife or I, ended up in the hospital, but thankfully everyone recovered. Greg Ippolito, an immunologist colleague of mine here at UT, took full scientific advantage of my situation, and I'm proud to have been turned into an official COVID study subject. This past June, we published an article in the prestigious journal Science. The article, which included a complete study of my own COVID immune response, described the most detailed molecular and cellular level analysis of the immune response to COVID yet reported. The findings will inform vaccine refinement and vaccination strategies against COVID variants well into the future. I know that each of you listening tonight have personal COVID stories, many of them tragic. My heart goes out to each and every person who suffered personally or lost a loved one, relative, or friend to this terrible virus. Last year at this event, we featured 2 scientists from UT Austin. Dr. Laura Lanson-Myers was critical to modeling the pandemic and therefore informing state, local, and national policy. Dr. Jason McClellan of UT Austin made an essential contribution to the design of the Pfizer, Moderna, and Johnson & Johnson vaccines. The vaccines would not have worked as well as they do now without his UT Austin contribution. Tonight, we are looking at the response to the pandemic from a very different point of view. At UT, as an institution, we had to balance our collective desire to be in person with concerns for safety during the pandemic. We also had to help lead the Central Texas medical response on a massive scale. The 3 leaders you're going to hear from tonight were making critical decisions during the chaos and uncertainty with no script, while simultaneously organizing the protection of UT students, faculty, staff, and the local community. This is so cool. I can't wait to hear from them because I have to tell you, I'm proud to say they are not only great leaders at UT, but also personal friends. I've had the privilege of watching up close as they operated during the pandemic. I've therefore grown to truly admire their selfless commitment and courageous decision-making. We are indeed fortunate to have them at UT and also fortunate to have them here this evening. It's my honor to introduce this evening's first speaker. It's Dr. Clay Johnston, MD and PhD. Dr. Johnston is currently a special assistant to the president and provost at the University of Texas at Austin and professor in the Department of Neurology at Dell Medical School. But from 2014 through 2021, Johnston served as Dell Med's inaugural dean, leading the first medical school built from the ground up at a top-tier research university in nearly 50 years. He is a neurologist specializing in stroke care and research. In 2019, Johnston was elected to the National Academy of Medicine. Dell Med became a national leader in the local COVID response, and who knows where we would be now if it were not for all that the new medical school and its faculty have brought to Central Texas. Dr. Johnston?
Well, thank you, Dean Iverson. It's a great pleasure and honor to be here. And as I put together the slides for tonight, well, I had a little PTSD, but actually it was very helpful to think through, just all that's happened, all that we've all been through together, all that we've been able to achieve, and then also what we've learned from this and how we can move on, I hope, even stronger. So I'm going to start by just going back to the beginning for me, just as you did for you. The second case in Austin was one that I was intimately involved in. And it was another UT personality, and there had been a UT party in New York, and at the time we knew that there were a few cases there. A person came home with flu-like symptoms, and one of the first tests that we had available in the city we used on this person. The results came back. It took forever to come back. It was like 3 days of just waiting. And in the meantime, the person's daughter got sick, and even more sick than the rest of the family. And so trying to help them to manage their symptoms, it was probably 11:30 at night, the results came back. And we waited till the morning to tell the family that, in fact, they, because it was going to end up being they, were positive for COVID. Unfortunately, before we contacted them, I got a call. This was at 4:30 in the morning, and the ambulance had arrived to assist the family. And of course, then it just your gut drops out. It's like now the 2 ambulance drivers, the EMTs on the scene, were now exposed as well. So that was when I came to the realization that this was not just going to be something in China or something in New York, but in fact that this was going to be something very real for Austin. And that's that first little blip that you see on this chart, the first case back in March. Even before that, we had 2 students return from Wuhan, 2 graduate students who had mild flu-like symptoms. And so this was in January, and the CDC wouldn't let us use tests on them because their symptoms were too mild. They were quarantined, so I think those didn't lead to any other cases, but I suspect those were probably our first cases in the city. So that's the very beginning. And then after that, we had our first peak. And I would characterize this peak as chaos searching for supplies. I spent hours and hours calling people all over the world, emailing folks, bringing in manufacturers, just trying to get masks, ventilators set up, gloves. For us at UT Health Austin and the med school, also for the city. And it was just crazy. I mean, I had no training in sourcing these supplies, but that became a critical question at that time. It was pretty much lockdown, but our first cases were those that continued to work. So it was particularly vulnerable populations that had to work through the initial crisis. And that was mostly construction workers and food service workers. And so the dominant population in that first peak were Latinx. And we quickly saw that and identified that in the city, identified where the outbreaks were occurring, but had very little control over the continued outbreak at that time. We were fortunate to see that through when the second outbreak began. That started really in October, November. This one I would characterize as being a little fatigue from lockdown and a lot of political discord. Particularly painful to watch that disagreement. A lot of education happening, but a lot of miseducation as well. That peak was worse than the first. We got very close to having the ICUs full at that time. We were starting to get major fatigue in our healthcare workers who couldn't believe that we had a second outbreak. We, as you all know, we lost a bunch of people in that second peak. So partially because as we learned from the outbreak that we needed to track something more reliable than the number of cases, we moved to tracking the number of hospitalizations that occur in any given day. And we gathered the city leaders, so the mayor, the county judge, the head of Austin Public Health, the head of the hospital systems, and a bunch of others. Lauren Ansel Myers was on that, and I was on that as well, and started to plan as a whole community. And as part of that too, we set the levels and stages of the outbreak. And I know you all are aware of this. You're probably all sick of seeing this chart. I mean, I certainly am. But it gave us a much clearer notion about how real, how immediate the outbreak was. So we got through that second one, and we were all just thrilled that things were getting better, and we had a vaccine available. I'm going to come back to this in just a second. When our third peak hit, and that's the one we're living through now, obviously things are getting much better over the last few weeks. It's come down dramatically. But actually, even though this peak doesn't look as bad as the second, the Delta variant cases have been more severe, and so the ICUs have filled up. So we've been over ICU capacity and had people in the hallways, sleeping in the emergency room for days. And honestly, our healthcare workers are so tired and a little bitter. And the bitterness comes from caring for people who had the opportunity not to be patients. And as much as one tries not to be judgmental, it's very difficult for those two that are disciplined around science to understand that and to forgive and move on and care for those who need it the most. But that's been a big issue in this last peak. So what happened? I mentioned early on the inequities that we saw with increased cases in the Latinx population. We also saw some increased cases in African American population as well, but not as profound. And it ends up that if we plot out cases, so that's the cumulative infections in the middle, there's this line down I-35. It also includes the Runberg neighborhood, which is the other side of I-35, the west side. But you can see that cumulative infections really follows that line. And then that also happens to be the line of social vulnerability. If one looks at measures of income disparities and housing security and food security, that follows this very same communities that were most affected by COVID. And sadly, at least initially, and this is held up pretty well, vaccine coverage is also less in those very same communities. So these inequities that existed in Austin and are reproduced all over the country, really all over the world, are one of the most painful things about the epidemic. And although we saw this coming, we were not able to adequately address it. So that's my quick history of COVID. I love the video clips that help me remember too. But if one thinks about this as a kind of discontinuity, just like the meteor that created the discontinuity in terms of the animal life on the planet, then what's going to happen next? Are there opportunities for us to learn and grow from this? And I'm going to just quickly talk about discontinuities in care, in population health, so how we care for the whole population, and in research. So in care. So first of all, and I don't have slides that show all this stuff, care stopped basically. People stopped coming in to see their doctor. They stopped getting mammograms or anything, any of the normal screening things that they should have gotten. They stopped having their meds filled. They stopped getting regular care. We switched to telehealth. So for a while there, 80% of our visits were by a telephone or a video call. And that made a difference. We started to convert people over. They're still way behind on all their screening and health promotion visits, but they're certainly somewhat catching up. We're not where we were and need to be, but somewhat catching up. But the telehealth visits, even though we don't need them anymore, people like them, and even in things that you wouldn't expect, like psychiatry. And so telehealth is here to stay. The rules are changing. It works incredibly well. It's really efficient. It works beautifully for some types of visits, and it makes it more likely that people will come in and be seen. That's a good example of a care advance that was so slow to happen before this, and then boom, now we have something that is going to improve health and health care for folks forever. On the population health side, so as I mentioned, huge inequities have existed forever in not just the US, all over the world. But in spite of science and social programs, we just are nowhere near addressing them. The pandemic made this far worse. Thankfully, with this and the attention to racism, we finally have some momentum towards addressing health inequities. And I don't have time to go into detail about how that's happening, but certainly there's a movement towards greater coverage for folks and additional support for social programs. I hope that stays. I think that's critical to us being a responsible country, but also being healthy as a country. It also changed the way we pay for things. It ends up that in fee-for-service, the traditional way, the standard way we pay for things, those that do fee-for-service lost a ton of money because people stopped coming in. Those who cared for people were much more effective through all this. In other words, they are paid for achieving better health outcomes for the people that they cover, and financially they were rewarded. And that's pushing more people towards this payment for achieving better outcomes. So the last part is the research part. So there was an article, it's really fascinating, that came out, it was like April 2020 in the New York Times, and it was like, how long is it going to take for a vaccine to be developed? And it has a little interactive tool. And they said, well, based on everything that's been done before, we think it's going to be 2033. That's typical. It typically takes anywhere from 10 to 20 years to get things done. we've learned a lot, so we don't think it'll take 20 years. But remember, too, the article pointed out, 90% of drugs and other therapeutics like vaccines, 90% of them fail during development. So these first ones that we're seeing tested are likely to fail. So, just relax. No treatment is coming soon. And they pointed out, too, that if we really had any chance to get anything done, the absolute best that we could possibly do would have been to deliver a vaccine in August of this year, so just 2 months ago. No one could hope for anything better than that. Well, of course, you all know the story, and it's really unbelievable that we got a vaccine in December. And not just an extremely safe vaccine and one that's unbelievably effective. We have very few vaccines that are that effective. That's changed everything about science and how each step of that was done, including the clinical trials, something that I work hard on. And that kind of pace, imagine if we could do that for cancer therapeutics, for drugs for cardiovascular disease, for neuroscience indications. We can definitely accelerate things, and now there's a lot of excitement about that. So in the end, looking back, this has been unbelievably hard, but I do believe we're going to come out on the other end stronger. We've learned a lot, not just about pandemics, but about science and care and society, and that is going to make us stronger. We have a lot of people suffering in healthcare right now. We've been through hell, and I know you all have too, and lots of folks have been impacted by COVID. But we've seen that impact firsthand every day, 80 hours a week. So please be kind to your healthcare workers, and please take precautions so that we don't see you in healthcare settings. And please join the adventure so that we can all sort of work together towards eliminating the risk of future pandemics and other major health issues that we have. Thank you.
Well, thank you, Dr. Johnston. I want to remind everybody that at the end, we're going to have a panel discussion, so we're looking forward to your questions. So just hit the Ask the Professor button and ask your questions, and I'm going to be asking the panel at the end of these presentations. Well, second tonight, we're going to hear from Dr. Alexis Stuifbergen, the Dean of the School of Nursing at UT and the Laura Lee Blanton Chair and James R. Dougherty Chair, Centennial Professor in Nursing. Dr. Stuifbergen is the third dean in the history of the UT Austin School of Nursing. She studies the self-management of chronic conditions and disabilities. It is fair to say that the nursing school at UT, including its current students and graduates, were truly on the front lines from day one of the COVID pandemic. Dr. Stuifbergen?
Thank you, Brent. It's great to be here tonight. And like Dr. Johnston, I also went through a little PTSD thinking back to how all this worked in the past. I'm trying to see, there we go. So what my part of the presentation is going to focus on is really what the impact of the COVID pandemic was on the School of Nursing students, so a specific subgroup of students who were living the same but somewhat different lives than many of the rest of you. And I want to talk about the impact on the undergraduate and graduate students, both the short and long term, how we managed some of those challenges, how we celebrated success, and then our most recent work, which is to vaccinate the UT community and the underserved populations. So as I was watching the video montage here at the beginning, thought too about this was, for most of us, Friday the 13th when we realized what was going on. That was the Friday before spring break. And you've just been here a few months, but you will find out when it's the Friday before spring break, you're on your way out of town. And so most students left and weren't really watching their email or paying attention, only, they left to go home for spring break, only to find out that they were not coming back after a week, that the university decided our first approach was to add an additional week to spring break while we figured out what the heck to do with this event that we had never experienced before. The immediate decision was to transition to online classes for all lectures and didactic courses, which was pretty significant undertaking for UT, but I'd have to say for us that was a minor challenge compared to how do we deal with clinical courses and required hours that students need in a profession and in a major that depends very much on how people are able to do various skills and enact knowledge and apply it. The other complicating factor was we knew virtually nothing about this virus. Every day we would get up and we had dean's meetings, hours and hours and hours, and then I would have leadership team meetings, and it would be new knowledge each time. There were things that we prayed wouldn't be true, like we prayed it wouldn't be that asymptomatic people would be able to transmit this virus, but lo and behold, we found out that they could. So everything we were doing, we would come up with a plan, and then usually we'd have to change about 85% of that plan the next day. This, for us, was all complicated by this acute shortage of personal protective equipment, as, again, Dean Johnston was referring to here, that we didn't have masks. Nobody had supplies sufficient for this. And what happened was our students could not go to clinical settings because they didn't have the protective equipment to keep them safe. So how did we manage some of these challenges? Well, I was delighted to have a great leader of our simulation and skills lab who literally called me on Friday the 13th and said, I've been watching this. And of course, the virus, it didn't hit us all by surprise on Friday the 13th. It's just that's when it really became real for us here in Austin. And she said, you know, I've explored them all. There's a great company we can get this virtual simulation where, again, students are taking care of patients virtually, making decisions, applying knowledge. And everybody in the country is going to be in line to get this. So you better, can you make the decision now? And I said, yes, buy it. So we made a decision very early on that allowed our faculty to have resources to help transition our students to more virtual clinical. We also focused on competency-based assessments. So typically our students, again, have clinical days and hours all through the semesters. Some students, by the middle of March, were competent what they needed for the class. We could let those students sort of go along their way. Others were not, and we knew those were the ones that we needed to really focus our resources on. Just as Dean Johnston mentioned, we had this whole creative supply chain solution. We were, again, looking everywhere high and low for masks and paying an unbelievable price for the ones we could get. We had 2 nurse-managed clinics, one in East Austin, one in the Dell Valley neighborhood, and we kept those open during the pandemic. We never closed for a day, and again, it was that same kind of activity of what's going to be new today, watching every day for how the CDC said to manage things. But we focused our students on our students who were supposed to graduate in May, and particularly those who had to have a certain number of clinical hours, our nurse practitioner students, who would not have been able to graduate and would not have been able to take their certification exams had they not had these actual hours with patients. They could not use simulation hours. So I'm very happy to say one of the greatest achievements was every single student graduated in May of 2020 that was on schedule to graduate. One of the things, though, we had to deal with on the way to that was our undergraduate students have a capstone experience that they look forward to literally the entire time they are at the university. The last semester of their senior year, they finish all their courses in 10 weeks, and then the last 4 weeks they spend with a nurse in a clinical setting working his or her schedule exactly. So it might be that they're working midnights in the emergency room in Dallas. They go all over the state for these activities. It's their favorite part. They synthesize everything. They really get a sense for what they're going to be doing once they become a professional nurse. And it often leads to their employment opportunity. Well, we had to cancel all of these. And there was tremendous anger, sadness, and loss about this. It was something, we all plan our lives and we think we can make things happen just because we've planned well. And COVID taught us something very different. So they did have to cancel those, and we had some other things we came up with to replace it. They got involved in public health activities here in Austin, but they did not get to do what they hoped. Well, about this time, I had a recent PhD graduate who sent me an email and said, Dean, how can I help? Now, I think she probably thought I was going to ask her to grade papers. But in fact, I said, yes, you can help. Her dissertation research. She was presently at that time in a postdoc fellowship at Harvard and Dana-Farber Cancer Institute. And her research was about helping professional caregivers, nurses primarily, deal with bereavement and loss related to the patient care activities. And I said, these students are so upset, they're lost, they're so disappointed in what's not happening. I want to see, can you do something for them? So back when we were all just new at Zoom, not quite sure what we were doing, she interviewed students, had focus groups with them, again, helping them give voice to the feelings and loss they were experiencing. She interviewed their faculty and also experienced nurses for sort of what was the balance and the advice that she could give them. From that, which is part of the music intervention that she does in her work, she developed a song, and we developed a video out of that we played at the 2020 graduation. And I'm going to take some time today to show you that video. The pictures that are in the video where they're not wearing masks, those were pre-pandemic. And then, of course, there are some that were taken during the pandemic. So please, if you would, cue the video.
There's a shadow where a capstone should have been, a missing piece where doubt comes creeping in. It's so hard letting go, with no goodbye at the end. Take a moment, take a breath. Trust your team, try your best. Remember what you've trained to do. Who's gonna step up? Who's gonna speak up? Who's gonna care if not for you? Who's gonna see us? Who's gonna hold us? Who else can lead us but you? Who else but you? You're the front line and our last defense. You've proved yourself, you've passed the test. You adapt and overcome with grace and finesse. Take a moment, take a breath. Trust your team, try your best. Remember what you've trained to do. There's power in the purpose guiding you. Hard days are gonna come, but who's gonna step up? Who's gonna speak up? Who's gonna care if not for you? Who's gonna see us? Who's gonna hold us? Who else can lead us but you? Well, find what fills you up. Take a moment, take a breath. Trust your team, try your best. Remember what you've trained to do. There's power in the purpose guiding you. Hard days are gonna come, but who's gonna step up? Who's gonna speak up? Who's gonna care if not for you? Who's gonna see us? Who's gonna hold us? Who else can lead us but you? There's a window where a capstone should have been, an open space where light comes shining in.
So this reminds me, watching that video, that one of the things I told the provost at the very beginning when she gave me the choice for whether I cut off clinical or kept going, she said, you know the situation, you make the decisions, Alexa. And I said, thank you, it's really nice being out on this limb. But one of the things I kept saying was, yes, it may be danger for us to go ahead, there's some risk, but the worst thing that could happen would be had we not been able to help these students finish their education during the pandemic. Worse for them and worse for society. So 2020, we were so happy. We got all those students graduated. Everyone took a breath. We thought this was going to be over, but of course, as you saw from the slides that preceded this, we had much more to come. In 2020, in the summer, we started our accelerated master's program. And I said, well, these students have to be in person. We cannot do this all online. And so we really served as the pilot for the university. We had students that were in clinical coming in. We had fully gowned and gloved the whole 9 yards. And in the fall semester, it went just fine in the summer with this small group of about 60 students. So in the fall, all of our students returned to in-person learning. 75% of their classes in clinical were in person. And again, we were able to do that safely with a lot of extra time, a lot of extra equipment. We had spent the summer acquiring amazing stock of PPE so that we could provide all this to them. And one of our foci was, how do we prevent outbreaks and clusters as we bring these students back in person? From the very beginning, we approached this through a lens of professional ethics, that part of being a professional nurse is taking care of yourself and staying healthy, and then helping other people stay that way as well. So our students were fantastic. Anytime they were exposed, whether it was a boyfriend, a roommate, whoever, they reported it to us so that we could help manage the quarantines, make sure they got caught up when they were through. We had faculty that were exposed, some through work, some through family. It was a nightmare, but it all, with great effort, happened. And we worked as we were going through this at maintaining connections among students, and also with the different rites of passage, whether they were graduation or pinning ceremonies or white coat ceremonies, ways to do those that allowed them to be more personalized. But everything changed on December 15th, 2020. That day is a day I will never forget in my life. And this is the very first vaccine being given in Central Texas. That's Erica Tabke, one of our faculty and an alum, giving it. This meant so much to healthcare providers in terms of hope was now on the horizon. The issue at the beginning was there was only limited supply of vaccine and everybody wanted it. So it had to be prioritized, and there were 1A was the top group, and that was healthcare providers, and students were healthcare considered as part of 1A. Now that was all great except that date, December 15th. Our students that lived out of town had been gone since Thanksgiving. So, we had let them know this was coming. We didn't know exactly which day it would be. A lot of them came back to town to get their vaccines. If not, then we had them ready when they came in January so they could become vaccinated. And then they, as you see in these pictures, worked actively in the clinics. It was an amazing experience that they worked right alongside their faculty. Everyone viewed this as really a historic opportunity. Pretty soon, we did get enough vaccine. We were able to move to Gregory Gym, I believe, in February. And the pictures here, the one on the far left shows you the queue going out the gym. But we started with about 1,000 people a day and eventually got up to 2,500. This was just a phenomenal experience. We had as many as 165 volunteers from all schools on this campus. Even our provost, I think, was out directing traffic one day for us. But the students, we even taught our younger students who normally wouldn't be ready to give vaccinations and shots, but we needed their help. They took a special course early, they volunteered. They got such great experience, got really comfortable with their skills, but also with working with people. And we couldn't have done it without them. They worked side by side, our faculty and also our interprofessional colleagues. This was the silver lining of the pandemic, was all the work we did with social work, pharmacy, and medicine to make this happen. But it became pretty obvious, as again you saw in the prior slide, that not everyone was making it into this hub at UT Austin. And so we started 2 initiatives in the School of Nursing that continue with UT Health and our interprofessional partners that continue to this day. One was Vax Now, where we took, at the end of the day, if there were some extra vaccines, we took those to people who were homebound and couldn't get out. And then VAMOS is a mobile vaccine program that goes pretty much where we're invited, but all kinds of interesting places, food banks, churches, places that want to host us. And so you can see again, there's lots of students in these pictures that are working again side by side with their faculty. We all view this, that every shot we give is saving a life. And the more we can do outreach and begin to make some impact on those curves, the better. So we celebrated in 2021 with a wonderful graduation. This group of students who went through 3 semesters of their professional education in a pandemic. I'm so proud of them. I'm so proud of our faculty. They constantly, everybody had to adapt to changing circumstances, and they did that. And I think that's what nurses do. But it's been some of the hardest times, but I would say it's also been some of the most rewarding and best times.
Well, thank you, thank you. You know, one thing I want to point out is at graduation this year, when the nursing students who were graduates stood up, they got a standing ovation from everybody in the audience, and I'm never going to forget that. Okay, last, but certainly not least, is Luis Zayas, Dean of the Steve Hicks School of Social Work and the Robert Lee Sutherland Chair in Mental Health and Social Policy. Dean Zayas is the 6th dean in the history of the Steve Hicks School of Social Work. He also holds an appointment as professor of psychiatry at the Dell Medical School. In his role as a national leader in social work, Dean Zayas is currently president of the Society for Social Work and Research, the largest social work research organization in the world. The response to COVID involves many communities, and as we've already heard, many of them have less than adequate medical resources in normal times. It's therefore important to hear the social work perspective on our response. Dean Zayas?
Thank you very much, Dean Iverson. And good evening, everyone. I want to tell you something about social work, to look back at what happened during the time that our 2 previous speakers spoke about, but also to look ahead at your own health. In social work, we say that human suffering happens, and whether it's an illness, Alzheimer's, addictions, autism, and now COVID, doesn't know social class, gender identity, anything like that. We're all subject to it. And it's important for us to recognize that any of us could be affected by the virus, and certainly our family members and our communities. And with that in mind, we also say that when there's suffering like that, our job is not to look at it and say it's inevitable, but rather to look at it and say it's intolerable. And whether you're a physician or a nurse or a social worker, you run toward that, at that which is the suffering, and begin to work on it. And that's what we saw during the early times of the pandemic at our school. One of the things that it did, of course, was that we all went to teaching online. And online, we saw, we revealed, if you will, the inequities among our own students. So in class, one student is sitting next to the other, and you don't know much more. But when you're online and you've got that webcam, behind you is your home. And we began to see the stark differences in what some students had and what other students didn't have. We kind of knew that, but that brought it home for us. And that was really an important moment for us, I think, not just at the School of Social Work, but across the campus. We began to see the inequities among our own students. Of course, we know that college education is a way of social mobility, so it's important that we know that part of being going to school is to advance, and those students may not have to worry about that in the future. But for that moment, it struck. And I think it's important for us to recognize that, and our students began to see it. There was something else that we saw when the pandemic struck. hunger, food insecurity among our very own students here on this campus. And we saw it at the School of Social Work and across campus, and immediately the campus mobilized to help our students. After all, many of them had lost their part-time jobs, besides not being in class. Their partners, their families had lost jobs, had moved in with them. Money was hard to get. Some of them became ill. Some lost family members. What we did at School of Social Work was we created a pantry, a food pantry where students could come anonymously and get food that they could take home to cook. A lot of it was canned goods, packaged goods, but we were able, with the generosity of some of our local merchants, to get fresh foods and fresh fruits and vegetables to our students. One of our donors gave us a brand new refrigerator because the one that we had was freezing the vegetables and we couldn't have that. That's the kind of generosity we stepped up. We served several hundred students that summer. It was served by students who served other students. It was faculty helping those students. We had people from other parts of the campus, including our police officers, come in and help. We had volunteers from our advisory council, the council that I have around me that helps me guide the school into its future, mostly friends, alumni of the school. They were there and came around to supply food and then to distribute it. That was an important moment. We were looking at the pandemic not just as an illness, but as revelation of the social inequalities among us. And that's important to keep in mind. And for that reason, social work is always there at the front lines with many other health professions to work at those conditions, to alleviate those conditions. But we know what's happened. As mentioned before, some of us have lost family members, friends, loved ones. We've lost fellow students, co-workers. We have seen our neighbor down the street be carried out, perhaps never to return. And some who have survived have survived with some lingering after effects. So there's still a lot of work to be done. And there's work to be done for you, that you need to do for yourself. So what I'd like to do is spend a few minutes talking about the stress that has come over us through the pandemic. Of course, we know that stress leads us to feelings of fear, anger, sadness, worry, depression, isolation, frustration. And it's one of those things that's inevitable, but it's also intolerable, and we can move to improving it. We know that stress also impairs our concentration and our decision making. We might have difficulty sleeping, perhaps even nightmares. And if we have a health condition, it might worsen. And looking for support, we might turn to the wrong sources, such as alcohol and drugs. So I think we have to keep in mind that if we are here, we need to take care of ourselves and take care of those around us. So here are some of the few tips I'd like to leave you with for good health into the future. One is keep informed. Listen to advice and recommendations from your local, national, and state leaders. Listen to the folks who have spoken here before me tonight. Keep informed on what's happening. But I ask you to limit or minimize the news feeds. Be careful for those news feeds because they don't always provide you accurate information, and they may only add to your anxiety and your distress. Perhaps you could look at it once or twice a day, but do it by doses. Try to reduce your screen time. Stay away from that computer as much as you can, the laptop. We're probably all guilty of that. But get up, walk around, get away from it. Do something else, another activity, and get away from it. Do also stay away from social media to the extent that you can. And again, avoid alcohol use because that is not a way to manage stress. Have a routine. Okay, create a routine if you don't have one. The daily routines that we've always had, it's good to do. One of the things that one of our great speakers and leaders here at the university, Bill McCraven, once said, is make your bed in the morning, right? That's a routine because when you come back to it, you know it's there and it feels comfortable. Well, get up and make your bed and do the same things every day at the same time. Keep up with your personal hygiene. Eat healthy meals at regular times. Exercise regularly, of course. Allocate time for working and for resting and for playing. Those are important as part of our way to survive this awful period in our history. Make social contact. I know that a lot of it has to be done through electronic means, but that's one way of connecting to others. Emails, Zoom, telephone calls, old-fashioned telephone calls are really important. And reconnect with your communities. Whether it's a local community or a faith-based community, it's important to connect with those individuals. After all, they are there to support you. You'll learn from them. You can share moments with them that you have shared in the past when you were in person, and you can share into the future. And one other thing is, I think the great satisfaction that Doctors Johnston and Stuifbergen and I enjoy is that the importance of helping others. That's probably what gives us the greatest satisfaction. That too can help you by helping others. Finally, if you're a parent, and I'm sure there are some parents out there, you can help your children through this time. Maintain familiar routines for your children, especially the young ones, or create new ones, as I said earlier. Discuss COVID. Discuss it honestly at a level that your children can understand. It's better that they be informed than they be in the dark or scared. And support them with all that home learning that they must do, all the work they might have to do online if they haven't yet returned to school. And help them stay in touch with their friends and your loved ones, their family members, grandma, grandpa. Make sure that they are connected and see to it that they enjoy those moments as best as you can. And again, just as I'm asking you to do, take away the screen time or reduce the screen time that your children spend on a daily basis, and try to ensure that they get exercise, that they can go out and run around, play, ride a bicycle, do the things that are so important for their health. And if you're a grandparent, I suggest you do the same things for yourself. Keep in regular contact with your families and your loved ones. Again, Zoom, telephone, email, whatever way works, texting, FaceTiming, all of those things are great ways to help your mental health and to help those around you. Keep regular routines, do your exercise, and of course, make sure that you get the medical care you need, the practical help that you might need, someone who can help you with food shopping, mowing the lawn, gassing up the car. Those are important, and it's a way of staying connected and getting your needs met. And thank you very much for being here tonight. I hope that these talks have helped you, and that with these last few tips, you might be able to maintain your health, but mostly maintain your mental health. Thank you very much.
Okay, I have to say, it's such an honor to be here with three such heroes of our community, of our campus. If we were live tonight, I would ask everyone to stand up and give all three of them a standing ovation right now, because I think they all absolutely deserve it for all they've done and continue to do. We have a ton of great questions. We don't have time to really get answers to all of them, but I'm going to start with one that came in from a variety of different people in a variety of different ways. And that is, they've got friends or relatives who are not interested in getting the vaccine and following the safety protocols. How do you think they should approach those individuals to try to get through to them on the importance of being vaccinated?
Who's going to take that one?
Well, I think we all wish we knew the answer to that. I think personally it's important to listen to those individuals and see what's behind their resistance. What is it? Are they misinformed? I once talked to a man who his daughter had been very much against him getting the vaccine because she believed we were injecting the virus into him. So it was a process of explaining to the family how this new technology worked and there was no virus. But I think it is, first of all, listening to find out. Secondly, maybe appealing to the fact that it's not just about them protecting themselves, but protecting other people, their family, the ones who love them, that don't want to see them either get ill themselves or give it to other people. I don't know, guys, do you have a...
No, I was going to add, and you've already done so, that of you're taking care of others by taking care of yourself. If you don't get vaccinated, mask wearing, washing your hands, doing all the right things protects you and protects those around you if you are not going to be vaccinated. But we do encourage you to vaccinate.
Yeah, I mean, there's there actually is some research to try to help us to figure this out. Unfortunately, the strategies that people have used have to be individualized. We'll just put it that way. And I'll say that, some of the stories that I have heard and see all the time, I find compelling, and I think others, you can find a story that is compelling and unique in your setting that may make the case. I mean, one example is I can't tell you how many patients we've had who've said, Doc, I'll get vaccinated now when they're in the hospital and suffering with COVID, and how immediately all their family members get vaccinated when one comes in. That sense of regret is just, it's overwhelming. So if there's a story there somewhere that's compelling a family member, a friend, or something that can maybe break down the other barriers.
Okay, another question that you could anticipate that this was going to come. When are we going to say this thing is over?
No one knows, right? So this is like, I guess last night you guys everyone refused to predict the weather, for whether we were going to have another snowpocalypse this year. I think that there are too many pockets around the world where people haven't been vaccinated and they haven't been that exposed. And we've seen that in the U.S. too, the way it passes around the U.S. I think this is going to continue for quite a while in isolated pockets across the world where outbreaks then occur from that spot. What we don't know is how quickly we'll see new variants. If each one of those is associated with new variants that then the rest of us don't have immunity to, or our immunity really wanes over time, which we really don't understand right now, then it's going to be more like flu. We're going to see milder cases because some of our immunity is going to stay with us, but we're going to see different strains occurring on a regular basis and popping up across the world every year until we get that vaccine that covers all the future coronaviruses. But that hadn't been created yet. So maybe with the speed of vaccine creation, we can do that faster.
Well, this sort of gets to that last point, and that is, how do you think our experience developing this vaccine so effectively and so quickly is going to permanently affect the way that we develop new treatments?
Yeah, so it's really interesting. This has been a big part of my career, is to try to get that whole research process accelerated. And there's so many different ways that we can do it, but we've put all these processes in place that create false barriers. And we've just allowed that time frame to exist. So I asked a question that I was interested in, new treatment for stroke, and it took 19 years to get the answer to that question. I think now we have seen a change in the way people are thinking about how they approach research, all aspects of it. The basic science, the sort of platform for doing the translational pieces, the animal studies and all of that, but also in particular the clinical trial piece as well. And I've seen now, I do believe actually that the advances in the clinical trials are going to stick, not be as dramatic as we saw for the COVID vaccine, because that was heroic actually to be able to do that. But probably take that time course and half it for the clinical trials piece. So that's typically, a 5-year piece for all those cycles of clinical trials. 2.5, that's awesome. And then I think the rest of it will accelerate as well.
And I have one final question for leaders of the university. How do you think this experience is going to leave a permanent impact on the university moving forward?
Well, I'm happy to jump in on that one. I think we have learned a lot through this experience, how we can teach differently, how classrooms can be set up both in person as well as online. But I think we're just at the beginning of discovering new ways of teaching and learning, and how the university can work and function in its educational mission. But I also do think too that we're going to see much more silos breaking up. Having had this experience where medicine, nursing, pharmacy, social work have worked together during this pandemic, I think that's going to be a model for as we go forward. And maybe we'll be studying in clusters of people rather than across specific disciplines. That's one of the areas that I think we'll see great change in.
I think one of the exciting things, as I often tell people outside the university, is I am so proud to have been part of UT Austin during this time. It's been absolutely phenomenal, the people that have stepped up in every way possible. And I think that is really a take-home message. People here are enormously talented, brilliant people who came out of their labs and found ways to help during this pandemic. And they're still doing it today. I've been on a task force that deals with all the health and wellness issues for the university. We've met every week. And it's people across the university, from communications to the lab scientists, who figured out when we couldn't get enough tests, how did we get that here at UT Austin? And we've really run like our own little city here, and it's been pretty amazing. And I think it's the practical and translational aspects that many of our great scientists and leaders have brought to us.
Yeah, I think we showed the value of a university of the first class.
Yeah,
that's right.
The way we worked together and the way we jumped at the problem in all aspects, in all different schools, and we did that collaboratively and interdisciplinarily with our students, with our other trainees. I think we proved our value.
Very much so.
Well, I think I speak for everyone when I say thank you for all that you have done. And thank you for watching tonight, and please be safe out there.